Today I'm going to be doing some vital signs, starting with Nicole's radial pulse. The minimum systolic pressure for radial pulse to be present is 80 millimeters of mercury, and the normal heart rate for an adult is 60 to 100 beats per minute. So I'm going to be checking Nicole's radial pulse for regularity, and if it is irregular, then this could indicate some abnormal cardiac functions. And I also want to check if the pulse is strong or weak. So I'm going to ask Nicole if I can take her radial pulse. Nicole, can I take your radial pulse? Yes, you can. So I'm going to be timing this for 15 seconds. So 15 seconds is up and I counted 18 beats. I'm going to times that by 4, which is 72, and that falls roughly between 60 to 100 beats range. I also noticed that Nicole's beats were regular and strong, which leads to no cause for concern. Today is blood pressure. To start, you need to remove any restricted clothing from the arm, so I'll be able to place the blood pressure cuff high up on the arm. But first I need to ask for permission. So Nicole, are you alright with me taking your blood pressure? Yes. Let me know if it's too tight. So you want to locate the patient's brachial pulse, which is on the medial side of the arm. Once you've located this, you want to inflate the cuff till you can't feel the pulse any longer. Once you can't feel it anymore, just give it one more squeeze and then go ahead and take your stethoscope. Take the stethoscope on the medial side of the inner elbow over the point where the pulse is read. You want to then slowly release the pressure till you hear the heart sounds. So the first sound is Nicole's systolic pressure, which was 120, and the point where the sound disappeared is her diastolic pressure, which was 72. So normal tentative measurements is systolic below 140 and a diastolic below 90. So Nicole's falls roughly between that range. A patient is considered hypertensive if their systolic is over 140 or their diastolic is above 90. So now I'm going to auscultate the chest, listening for volume and clarity of each breath. You would normally auscultate the chest anteriorly and posteriorly. However, for today, I'll be doing an example of the anterior of the chest only. So first of all, you need to gain consent. So Nicole, is it alright if I listen to your chest? It may be a little bit cold. Yep. Cool. So can you please take a deep breath for me through your mouth? So in and out. And in. And out. Cool. So now I'm going to take a look at the lower lobes. Shirt here, so in and out. We're going to go here, so in and out. So all of the lobes of the lungs sound clear and there was a good volume, which indicates equal air entry to both sides of the lungs. Next, we're going to be doing a familiarization with the LifePak 12 ECG monitor and defibrillator. So before you start, you want to check the batteries, which are located on the back end of the machine. So just so the batteries are located under this flap, so just take this off. So these are the batteries, and to check the charge on them, you want to click the grey button and the lights will show you exactly how much charge is left in the batteries, and if they are flat, you can just remove them like so, put them on charge, and once they are charged, then you can place them back into the machine. But just remember, when you do place them back on, you want to click the grey button once again to check if they are in fact charged. So to turn on the LifePak 12, you want to press the green on button like so, and we want it on manual mode, so we'll be clicking Energy Select, and we want to turn the dial to yes to change the manual mode, and we'd want to bring it back down to 50 joules for our test. So to do an operational test, you want to click Options, scroll down to User Test, and it will print out a user test for you. So when you did click the user test, it will print out this user test for you, and it will say the date and the time, and it will also say user test pass. So it does say user test pass, so the machine is good to use. So we also want to do a test defibrillation. So the left hand side of the LifePak 12 is the defib side. So we want to attach our defib to a test load. So and we also then want to charge the machine, so you would click the orange charge button, and once the charge is ready to be administered, you want to then click the red shock button and it will administer the shock. So everyone's all stand clear and the shock will be administered. So to disarm the shock is a similar technique, so you want to charge the machine once again. But to disarm it, you just click the select button like so, and it will disarm the charge. We're changing from manual mode to AED mode. You can choose between the leads by pressing the lead button. It gives you a number of options, and you can simply choose whichever one you want, and it will come up on the light feed. So you click lead, the one you desire, and you can also then select through the channels like so. And if you want a specific lead, you can then also change that and have a look at that as well. So also to adjust the QRS volume, you can go over to the heart rate section, which is located here, and you can either raise the volume or lower the volume, like so. And also, if you want to change the amplitude of the ECG size, you can select the channel, go to size, and you can choose from 1.0 to 4.0, as well as you can also choose 0.25. So the ETCO2 detector is located in the right hand pouch, and it gets installed into the ETCO2 port here on the LifePak. So this is the ETCO itself, and also the non-invasive blood pressure button is located here on the LifePak 12. So also to change the ECG paper, there should be a spare roll located at the back of the LifePak, like so, and if you want to change it, all you need to do is pull out the paper like so, pull out your empty roll, put in a new roll, and you want to then close the port like so, and you want to check that it is in properly, so you want to click print, and it will print out some paper, and then you know that it is actually in there. So also after you've done that, because when you turn the LifePak 12 on, it will go straight into defib pads mode. So in the left hand pouch you will find your defib pads. Here you'll also find your 12 lead ECG cables, and there will also be a bag that has a GTN, aspirin and a razor if you have a hearing patient. And also in the right hand pouch you will find your normal ECG leads, which are attached to me, your SPO probe, which is here, and your ETCO cable as well, your consumable, sorry. And also while viewing the live feed, if a lead was to come off, you would get a display on the monitor like so. So there'll be a dashed line, and this doesn't mean that it is asystole. So you would then just simply place the lead back onto your patient, and the monitor will be restored with their vital signs. Another form of airway management is a nasal pharyngeal airway using an MPA. You measure the MPA from the nostril to the mandible. So as you can see, this one is way too long for the patient, and this one is a little bit more appropriate for this patient. So you want to lubricate the MPA with a water-based lubricant, and then you want to insert it at a 90-degree angle to the patient's face. If you encounter any resistance, you can just twist it to a 180-degree angle and it will help with the insertion. If you encounter any more resistance, you can remove it and insert it into the other nostril. You want to insert it until the flange, so the top of the MPA, is reached the nostril. So the benefits of having an MPA is that you are not inducing gag reflex or vomiting. They can be inserted into a patient with high GCS scores and in a patient with trismus. MPA is contraindicated for basal skull fractures, and any complications that may arise are nasal polyps and or bleeding. We're going to be doing some airway management, so first you want to tilt the head back to open up the airway. You want to then measure OPA from the mouth to the mandible, like so. And then when inserting the OPA, you want to insert towards the curved bit towards the mouth, and you want to twist it 180 degrees to avoid catching the tongue. Assess if the patient accepts the OPA, and also there's a couple of complications that can arise, such as induced vomiting if the OPA is too large, damage to the oropharynx, or worsened airway obstruction if you push the tongue posteriorly. So reasons for using an OPA is if the patient has a GCS of less than 8 or a scoring less than 2 on a verbal response. When applying a cervical collar, you want to utilise the Nexus rule, which is the National Emergency X-ray Utilisation Study rule. So the indications for applying a cervical collar is posterior midline cervical tenderness. So you find that by palpating, and they have no evidence of intoxication, they're alert, and their mental state is a 5 out of 5 on the verbal score. You also want to look at neurological deficits, so if there's any numbness in the fingers or toes or any other pain or distracting injuries. So for applying a collar, you need to explain the procedure to the patient, and you also want to gain consent. So once you've gained consent, you need a second person to help stabilise the head. So Nicole, if you could please hold the patient's head. Thank you. So to measure a C-collar, you want to measure from the clavicle to the chin with your hand, like so. And so this is about a 4, so you want to then measure this on the collar from the bottom blue line up. So once you've got the size that you want to lock it into place. So once it's adjusted to the right height, you want to then pre-bend the collar so it's a bit easier when it's going around the neck. So you want to get this on nice and tight. And it needs to be tight so that it mobilises the neck. When delivering oxygen to a patient, you need to always ask for consent prior to putting on the mask. So there are 3 ways of identifying an oxygen bottle. The first is the through port on the pillar valve for the regulator. The second is the label on the bottle, and the cylinder itself is white. So there's 5 different oxygen delivery devices that we use. The one is nasal prongs, and they deliver 28% oxygen and have a flow rate of 2 to 4 litres per minute. The second is the acute or Hudson mask. This administers 60% oxygen with a flow rate of 6 to 8 litres per minute. The third is the non-breathable high concentration mask, which delivers 90% oxygen at a flow rate of 10 litres per minute. Then you have the bag valve mask, and this delivers approximately 98 to 100% oxygen at a flow rate of 10 to 15 litres per minute. And then finally you have the nebulizer, which is used to administer liquid drugs and deliver 60% of oxygen at a flow rate of 6 to 8 litres per minute.